This is a CMA Administrative Knowledge Practice Test. This test consists of 50 questions designed to help you prepare for your Administrative Knowledge section of the Medical Assistant Certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Let's get started. 1. The term debit means A. Total, B. Subtract, C. Charge, D. Subtotal, E. Balance. Correct answer, C. Charge. A debit is an amount usually representing things acquired for the intended use or benefit of a business. A debit is also called a charge. Debits are incurred when the practice pays for something, such as medical supplies. The total, A, is the entire amount owed, collected, or accrued on the daily summary. You would subtract, B, or remove an amount from the total when a payment is made. The subtotal, D, is the amount before taxes are added. The balance, E, is the amount owed after payments are deducted and taxes added. 2. The body of an email communication should A. Provide all available background information on the topic. B. Be formatted in italic and boldface type for emphasis. C. Be brief and to the point. D. Be written in capital letters. E. Be written without any capital letters. Correct answer, C. Be brief and to the point. Email has to be short and to the point. Email is set up to be read quickly. Additional background information can be communicated later. A. Writing in italic can be harder to read. Furthermore, not all email systems pick up formatting such as bold, italics, and color. B. So the recipient may not see it. Writing in capitals is equivalent to shouting in an email and may be harder to read. D. It is more professional to use capital letters in email just as you would in a business letter. E. 3. Under which of the following systems are two patients scheduled for the same appointment time? A. Modified wave. B. Double booking. C. Wave scheduling. D. Open scheduling. E. Modified scheduling. Correct answer, B. Double booking. Double booking is commonly used in scheduling appointments when the patients only need to see the physician for a short time. 4. Referrals are given to which of the following patients? A. All patients who need to see a specialist. B. PPO insurance patients who need to see a specialist. C. HMO insurance patients who need to see a specialist. D. POS insurance patients who need to see a specialist. E. Uninsured patients who need to see a specialist. Correct answer, C. HMO insurance patients who need to see a specialist. HMO insurance requires a referral to see a specialist. The primary care physician must create the referral for insurance purposes. 5. Computer systems can do all of the following medical office tasks except A. Schedule appointments. B. Deliver lab results. C. Diagnose patients. D. Maintain patient PHRs. E. Locate patient files. Correct answer, C. Diagnose patients. Only a healthcare provider can diagnose patients. A computer cannot undertake this task. One of the most important uses of computers in the medical office is to schedule appointments. A. Provider portals are typically capable of delivering lab results. B. And maintaining patient health records. D. Where patients compile their own health information. While many medical practices continue to rely on paper records, there is an ongoing shift toward electronic storage of patient files. E. 6. The billing schedule is often determined by A. The number of healthcare providers in the group. B. The size of the medical practice. C. What types of providers are in the medical office. D. How many employees do the billing. E. When the provider wants the billing cycle to take place. Correct answer, B. The size of the medical practice. The size of the medical practice always determines which billing cycle is used. The size of the practice, rather than the number of physicians, determines the billing cycle. The type of medicine that the physicians practice, is not a factor. The amount of employees who do the billing, does not matter. The physician will prefer a billing cycle that fits the practice size, 7. All money owed by the practice to other businesses is called A. Accounts payable, B. Accounts receivable, C. Charges, D. Debits, E. Owner's equity. Correct answer, A. Accounts payable. Accounts payable refers to all money owed by the practice to other businesses. Accounts receivable, B, is the money owed to the practice. Charges, C, are the items billed to patients. Debits, D, is an accounting term used to describe money paid out by the practice, and owner's equity, E, is the profit made after taxes and expenses. 8. All of the following documents should be shredded prior to disposal except A. Appointment list, B. Patient lab results, C. Patient referral, D. Photocopy of patient insurance card, E. Unmarked HCFA 1500 form. Correct answer, E. Unmarked HCFA 1500 form. HCFA 1500 is the universal claim form accepted by most insurance carriers. If left blank, this form contains no sensitive patient or medical office information and can be disposed of without shredding. The appointment list, A, patient lab results, B, patient referral, C, and patient insurance card, D, should all be shredded before disposal to maintain confidentiality. 9. Flexible office hours occur most often. A. In group practices, B. In hospitals, C. In specialists' offices, D. In primary care providers' offices, E. In single provider practices. Correct answer, A. In group practices. When a practice has flexible office hours, it stays open at unusual hours on certain days in addition to normal business hours. This occurs most frequently in group practices. 10. POMR is the abbreviation for A. Problem-oriented medical record, B. Patient-oriented medical record, C. Problem-oriented medical record, D. Patient-oriented medical report, E. Program-oriented medical record. Correct answer, A. Problem-oriented medical record. The problem-oriented medical record is used to document a patient's information according to the problem the patient is having. 11. Petty cash may be used. A. For paying minor incidental expenses, B. For paying an invoice for supplies ordered, C. For paying the electric bill for the medical facility, D. Only by the physician, E. Only in emergencies. Correct answer, for paying minor incidental expenses. Petty cash is a small amount of paper money and coin used to pay for minor things needed by the staff to run the medical office. An invoice for supplies ordered, B, would be too large to be paid out of petty cash. The electric bill, C, would be paid with the monthly bills and taken out of the medical office account. The petty cash would be available to authorized employees to use, not just the physician, D. It should be used as needed, not only in an emergency, E. 12. After opening the mail, a medical assistant should A. Read it for importance, B. Put it aside until the patients are gone, C. Give it to the provider immediately, D. Date stamp the letters, E. Put it in a folder to deliver later. Correct answer, D. Date stamp the letters. It is necessary to date stamp each piece of mail when it is opened so the mail can be answered or addressed in a timely manner. It is not the job of the medical assistant to read the provider's mail, A. Putting the mail aside until the patients are gone for the day, B, is a way for mail to get lost. The mail should be given to the provider promptly, but not immediately. C. It should first be stamped with the current date. The mail should be delivered immediately to the physician after being stamped, not set aside to be delivered later. E. 13. When removing a record from the file cabinet, which of the following items should the medical assistant put in its place? A. A sticky note. B. An empty folder. C. Nothing. D. A process note with the medical assistant's name. E. An out guide. Correct answer, E. An out guide. An out guide can be used to identify who has a document or record. It can be plastic or paper and is available in a variety of colors. 14. When a patient has to cancel an appointment, the medical assistant should A. Remind the patient of the importance of medical appointments. B. Ask the provider to authorize the cancellation. C. Record the cancellation and thank the patient. D. Try to reschedule the appointment. E. Ask the patient to call back when ready to reschedule the appointment. Correct answer, D. Try to reschedule the appointment. Rescheduling the appointment while the patient is on the telephone will save both the medical assistant and the patient time. Appointments are important, A, but there are times when an emergency does come up. The provider cannot make a patient keep an appointment, B. Saying thank you is polite, C, but it is best to ask if the patient would like to reschedule now. Asking the patient to call back to reschedule an appointment, E, is not an efficient way to run an office. 15. To verify identity, the medical assistant should request the patient's A. Date of most recent medical office visit. B. Date of birth and social security number. C. Credit card number and date of expiration. D. Health insurance carrier and employer name. E. Health portal password. Correct answer, B. Date of birth and social security number. To validate that you are speaking with the patient, you should request two patient identifiers, such as date of birth and social security number. The date of the most recent medical office visit, A, is not a patient identifier. Credit card number and date of expiration, C, would be used to take payment, not to verify identity. Health insurance carrier and employer name, D, would be taken to process insurance claims, not to verify identity. The patient's health portal password, E, should not be shared with anyone, including the medical assistant. 16. Which of the following is an acceptable form of payment for a patient visit? A. Cashier's check. B. Payroll check. C. Post-dated check. D. Third-party check. E. Unsigned personal check. Correct answer, cashier's check. A cashier's check is an acceptable form of payment that is written using a bank's own check form and signed by a bank representative. Like any other type of check, it should be inspected for accurate documentation. Post-dated checks, C, third-party checks, D, and unsigned checks, E, should never be accepted. A payroll check, B, is a type of third-party check. It cannot be accepted as payment for a patient visit. 17. The patient pays a copayment. A. In advance of the visit to the medical office. B. Before being seen by the provider. C. After seeing the provider. D. While in the exam room. E. Upon receiving a bill from the medical office. Correct answer, B. Before being seen by the provider. Copayments are collected when the patient checks in to see the provider, unless other arrangements have been made prior to the appointment. Patients do not need to pay in advance before coming to the medical office. A. Collecting a copayment after the patient sees the provider, C, is not ideal because the patient may be able to leave without paying. The patient should not pay while in the exam room, D. Bills are only sent out if the patient has an outstanding balance, E. 18. Which of the following is the most secure way to mail something through the United States Postal Service? A. Certified mail. B. Insured mail. C. Registered mail. D. First-class mail. E. Priority mail. Correct answer, C. Registered mail. Registered mail is the most secure service offered by the post office. Registered mail provides insurance coverage for valuable items and is controlled from the point of mailing to the point of delivery. Certified mail, A, offers a guarantee that the item has been mailed and received by the correct party by requiring the mail carrier to obtain a signature on delivery. Insured mail, B, is for any piece of domestic mail for damage or loss. First-class mail, D, is classification by the weight of 13 ounces or less. Priority, E, is the classification for mail that weighs 70 pounds or less. 19. Which of the following is a key element of promoting interoperability? A. Monitoring written prescriptions. B. Data exchange between providers, patients and/or public health entities. C. The transport of medical records to legal proceedings. D. Control over a patient's access to their health information. E. Better filing systems to avoid lost records. Correct answer, B. Data exchange between providers, patients and/or public health entities. Promoting Interoperability, PI, is the result of an overhaul of the Meaningful Use Program, part of an initiative by the Centers for Medicare and Medicaid to increase the use of EHRs. There are four main objectives of PI: e-prescribing, health information exchange, provider-to-patient exchange, and a public health and clinical data exchange. 20. Which of the following is an accurate statement about the implementation of the ICD-10 coding system? A. It only applies to hospitals. B. It was developed by the American Medical Association. C. It is capable of documenting a detailed level of specificity. D. It is optional for all providers. E. It removes responsibility for coding from medical assistants. Correct answer, C. It is capable of documenting a detailed level of specificity. The ICD-10 coding system documents a more detailed level of specificity than its predecessor due to the move from a maximum of 5 digits to 7 digits and a database of more codes. All providers must use ICD-10 to code the classification of diseases, illnesses, and injuries, not just hospitals. A. ICD-10 was developed by the World Health Organization, WHO, not the American Medical Association. B. The system is not optional. D. It is mandatory. ICD-10 does not remove responsibility for coding from medical assistants. E. To the contrary, medical assistants must be familiar with the system to complete documentation and medical record information for office patients. 21. Which of the following is computer hardware? A. Appointment scheduling program. B. Cloud storage. C. Dictation transcription app. D. Electronic health record. E. Mobile tablet. Correct answer, E. Mobile tablet. A mobile tablet is an example of computer hardware. In the medical office, this type of device is often used for wireless data input, example, patient check-in, provider's notes of a patient encounter. Appointment scheduling programs, A, apps, C, and EHRs, D, are all examples of computer software, and cloud storage, B, is a service that stores data off-site. 22. Wave scheduling works best when used in which of the following types of offices? A. Urgent care facilities. B. Specialist offices. C. 2 physician practices. D. 1 physician practices. E. Large medical facilities. Correct answer, E. Large medical facilities. Wave scheduling works best in large facilities where there are enough personnel to give service to several patients at once. 23. Which of the following systems divides the patients of a practice into groups and bills each group at a different time of the month? A. Past due. B. Account aging. C. Cycle billing. D. Wave scheduling. E. Monthly billing. Correct answer, C. Cycle billing. In the cycle billing system, all accounts are divided alphabetically into groups, and each group billed at a different time. Past due, A, is when services are rendered and a balance is owed but has not been paid in the past 30 days. Account aging, B, is a method used to determine how long an account is overdue. Wave scheduling, D, is a method of scheduling appointments and is not related to billing. Monthly billing, E, is the method that sends all bills out at the same time each month, usually around the 25th of the month. 24. How frequently should the medical assistant renew on-call repair service contracts? A. Every 3 months. B. Every 6 months. C. Every year. D. Every 2 years. E. Every 5 years. Correct answer, C. Every year. If the medical office has contracted with a repair service to fix office machines whenever necessary, the medical assistant should renew the agreement annually. 25. The ICD-10 system of classifying diseases into categories was devised by what organization? A. HCFA, Healthcare Financing Administration. B. AAMA, American Medical Association. C. AAMA, American Health Information Management Association. D. WHO, World Health Organization. E. IRS, Internal Revenue Service. Correct answer, D. WHO, World Health Organization. The World Health Organization developed the International Classification of Disease system for use in describing and tracking diseases across the globe. HCFA, A, is the former name of the Centers for Medicare and Medicaid, a branch of the U.S. government that is accountable for oversight of Medicare and Medicaid entitlement programs. AAMA, B, is the Professional Association for U.S. Physicians. AAMA, C, is the professional organization for medical record and health information experts. The IRS, E, is the branch of the U.S. government that oversees taxation. 26. Which of the following terms refers to the actual daily recording of the accounts or business transactions of the medical office? A. Day sheets. B. Charges. C. Account receivable. D. Bookkeeping. E. Pegboard. Correct answer, D. Bookkeeping. Bookkeeping is the actual daily recording of the accounts or transactions of the business and is the major part of the accounting process. A day sheet, A, is used to list or post each day's charges, payments, credits, and adjustments, the daily financial transactions. Charges, B, are the fees for services rendered. Accounts receivable, C, is the amount owed to a business for services or goods supplied. A pegboard system, E, consists of day sheets, ledger cards, charge slips, and receipt forms. 27. If the medical office has a patient who is always late for appointments, the best time to try to book this patient is A. At the beginning of the day. B. In the middle of the day. C. Right after lunch. D. Never, do not schedule. E. At the end of the day. Correct answer, A. At the beginning of the day. The beginning of the day would be the best time to schedule. If the patient is late, it will not disrupt the end of the day's schedule. Middle of the day, B, would disrupt the afternoon schedule. Right after lunch, C, could cause the afternoon to back up. Never scheduling a patient, D, is not appropriate and does not support a customer service approach. Scheduling the patient at the end of the day, E, could delay closing the office on time. 28. Oversight of the patient may include monitoring care, facilitating referrals, and serving as a point of contact. In the patient-centered medical home model, a medical assistant who takes on responsibility for these elements is acting in the role of A. Project manager. B. Case leader. C. Gatekeeper. D. Patient navigator. E. Head nurse. Correct answer, D. Patient navigator. Medical assistants who monitor care, facilitate referrals, and serve as a point of contact for the patient are acting in the role of patient navigator. In this role, the medical assistant is responsible for providing information to patients and fostering empowerment so patients make decisions that are their best interest. A medical assistant can serve as the liaison between the provider and other members of the healthcare team, and is often the one to actively communicate with the patient. 29. A patient has paid for an office visit with cash. Which statement best reflects what the medical assistant should do? A. Document the payment and give the patient a receipt. B. Thank the patient but clarify that cash is not accepted for services. C. Immediately enter the cash amount on the bank deposit slip. D. Put the cash in the office safe for deposit at the end of the week. E. Use petty cash to provide change. Correct answer: document the payment and give the patient a receipt. Although the practice is increasingly uncommon, patients may still pay with cash for services rendered. Documentation of the payment in the accounting record is important for balancing funds and accurately reflecting the patient payment on their account, and providing a receipt is important for the patient to have a record of the transaction. A. Cash should never be refused. B. Deposits should be made on a daily basis, not weekly. D. And deposit slips are typically completed at the end of the day. C. Petty cash is used for small office expenses and not to make change for payment of services. E. 30. An itemized document that details the services delivered to patients is called a /in. A. CMS 1500. B. Ledger. C. Subrogation. D. HCPCS. E. Superbill. Correct answer: CMS 1500. The superbill is the document the patient receives from the physician at the time of service delineating the visit, tests, diagnoses, and charges. CMS 1500-A is the claim form accepted by most insurance carriers. This form is prepared using words and CPT codes for procedures performed and ICD-10 CM codes for diagnoses. A ledger, B, is a record of charges, payments, and adjustments. Subrogation, C, is the right of a third party such as an insurer to collect debts. The HCFA Common Procedure Coding System, HCPCS, D, is used to bill for products, services, and supplies that are not included in CPT codes. 31. When scheduling, the medical assistant should ask the patient the purpose of the visit. A. To facilitate the provider's preparation. B. To determine how much time is needed for the appointment. C. To determine what supplies are needed for the visit. D. To make sure that there is enough room on the progress note. E. To facilitate double booking of appointments. Correct answer: B. To determine how much time is needed for the appointment. Asking the purpose of the visit is a way to control the schedule. You can accurately schedule appointments so that patients are not waiting to be seen. 32. Which of the following best describes the intent of the move to the ICD-10 CM system in the United States? A. To add complexity to the delivery of healthcare. B. To improve the specificity and efficiency of medical coding and billing. C. To add more codes to the list of available ways to name a disease. D. To use the same system that other countries on the globe use. E. To require electronic records and bills. Correct answer: B. To improve the specificity and efficiency of medical coding and billing. The ICD-10 CM system is intended to improve the specificity and efficiency of medical coding and billing. Adding complexity, A, was not a goal of the system, and it does not require electronic records and bills. E. ICD-10 CM does add more codes to the pool available to identify a disease. C. And it uses the coding system as other countries. D. However, these were not major intents behind the change. 33. The claim form that is accepted by most insurance carriers is a /in. A. Claim register. B. Superbill. C. CMS 1500. D. Diagnosis codes. E. Modifiers. Correct answer, C. CMS 1500. CMS 1500 is the claim form accepted by most insurance carriers. This form is prepared using words and CPT codes for procedures performed and ICD-10 CM codes for diagnoses. A claim register, A, is a diary or register of claims submitted to each insurance carrier. When payment is received, the date and amount of payment is entered in the register. A superbill, B, is the document the patient receives from the physician at the time of service delineating the visit, tests, diagnoses, charges, and when to return. A diagnosis code, D, is the numerical designation for a specific illness, injury, or disease. Modifiers, E, are two-digit numeric codes that indicate unusual procedural services. 34. The information entered on claims is called A. Demographic information. B. Health history information. C. Chief complaint. D. DRG. E. Medical information. The correct answer is E. Medical information. Demographic information, A, includes facts about the patient, such as name, address, and date of birth. Health history, B, is part of the medical record in the patient's chart, as is C. Chief complaint. DRG, D, refers to the diagnostic-related group assigned to the Medicare patient for an inpatient stay and is used for Medicare billing. 35. All of the following are principles of the AAMA's Code of Ethics except A. Adhere strictly to confidentiality laws. B. Provide quality service while preserving human dignity. C. Continue to study and increase knowledge. D. Network with other healthcare professionals. E. Act at all times to improve the public health. Correct answer, D. Network with other healthcare professionals. Networking with other healthcare professionals would promote the medical assistant's professional development, but it is not an ethical principle. It is not part of the AAMA's Code of Ethics. In addition to adhering to confidentiality laws, A. Providing quality service, B. Increasing knowledge, C. And acting to improve the health of the general public, E. The AAMA's Code of Ethics calls for medical assistants to maintain honor and professionalism. 36. Which of the following is not a section of the CPT book? A. Evaluation and management. B. Anesthesia. C. Pathology and lab. D. Surgery. E. Gynecology. Correct answer, E. Gynecology. Gynecology is not a section in the current procedural terminology book. The 7 sections are 1. Evaluation and management, A. 2. Anesthesia, B. 3. Surgery, D. 4. Radiology, nuclear medicine, and diagnostic ultrasound, 5. Pathology and laboratory, C. and 6. Medicine. 37. Which of the following types of incoming mail should the medical assistant attend to first? A. Priority mail. B. Registered mail. C. First-class mail. D. Provider's personal mail. E. Airmail. Correct answer, B. Registered mail. Items that are sent via registered mail, certified mail, or overnight mail have top priority. The next level of priority includes personal or confidential mail, D, and the following level includes priority mail, A, airmail, E, and first-class mail, C. 38. Which of the following statements is not true about a typical purchasing procedure in a medical office? A. An authorized person should be in charge of purchasing. B. Receipts of goods should be recorded. C. High-quality goods should be ordered at the lowest price. D. Shipments should be checked against packing slips. E. Every employee can order supplies and write a check from petty cash. Correct answer, E. Every employee can order supplies and write a check from petty cash. Only authorized employees can take money from petty cash. An authorized person should be in charge of purchasing because too many different people ordering can cause confusion. A. All receipts of goods need to be recorded so a record of the goods can be kept. B. It is best to purchase goods of high quality at the lowest possible price. C. All shipments received need to be checked against the packing slip to ensure that supplies ordered were received. D. 39. Lack of payment is usually not considered serious until after A. 30 days. B. 45 days. C. 60 days. D. 90 days. E. 120 days. Correct answer, D. 90 days. Once the overdue account has reached 90 days, it is considered serious. 40. Which of the following methods is used to correct a written error in patient documentation? A. Cover the error with correction fluid. B. Try to write over the error. C. Draw a single line through the error and make the correction above the error. D. Use red ink to write the correction in the margin. E. Rewrite the process note. Correct answer, C. Draw a single line through the error and make the correction above the error. The way to properly correct any written error in the medical record is to draw a single line through the error and make the correction above the error. This method is used so the error can be seen in this legal record. 41. Which type of check is frequently used for payroll because it itemizes the purposes of the check and deductions? A. Bank draft. B. Voucher check. C. Limited check. D. Certified check. E. Cashier's check. Correct answer, B. Voucher check. A voucher check contains a detachable voucher form. The voucher portion is used to itemize the purpose of the check, deductions, or other information. A bank draft, A, is a check written by a bank against its funds in another bank. A limited check, C, is issued on a special check form that displays a pre-printed maximum dollar amount for which the check can be written. A certified check, D, is written on the payer's own check form and verified by the bank with an official stamp. A cashier's check, E, is written using the bank's own check form and signed by a bank representative. 42. It will be most difficult to collect past due accounts from A. Those who just forgot their bill. B. Someone who is unwilling to pay. C. A person having financial hardship. D. Someone who has no insurance. E. Everyone who owes money. Correct answer, B. Someone who is unwilling to pay. It is very difficult to get payment from a patient who does not want to pay. Such a patient may have a reason for believing that a payment does not have to be made. A patient who has forgotten to pay, A, can be reminded by receiving a payment statement or a telephone call. A person having financial hardship, C, may not be able to pay the entire amount but is often willing to make small payments to clear the debt. A patient who has no insurance, D, can be put on a monthly payment plan. Most patients who owe money will pay their bills, E. 43. Which of the following systems bills all accounts at the same time each month? A. Past due. B. Account aging. C. Cycle billing. D. Wave scheduling. E. Monthly billing. Correct answer, E. Monthly billing. Monthly billing is the method that sends all bills out at the same time each month, usually around the 25th of the month. Past due is when services are rendered and a balance is owed but has not been paid past 30 days. A. Account aging is a method used to determine how long an account is overdue. B. In the cycle billing system, all accounts are divided alphabetically into groups, and each group billed at a different time. C. Wave scheduling is a method of scheduling appointments and is not related to billing. D. 44. The medical assistant should ensure the healthcare provider has room for which of the following each day? A. Waive scheduling. B. Double booking. C. Open hours scheduling. D. Emergency booking. E. Pharmaceutical booking. Correct answer, D. Emergency booking. Each appointment day should have times allotted for emergency appointments. Waive scheduling A, where several patients are scheduled for the top of the hour, is based on the idea that some patients will be late and other patients require more time with the doctor. When double booking, B, more than one patient is scheduled at the same appointment time. Open hours scheduling, C, is the system in which patients arrive at their own convenience with the understanding that they will be seen on a first-come, first-seen basis, unless it is an emergency. Physicians who see pharmaceutical representatives, E, often block out certain times and days when they can be seen. 45. In which of the following locations should file drawers be labeled? A. Inside the drawer. B. On the side of the drawer. C. In a separate listing in the tickler file. D. On the outside of the drawer. E. In the office database. Correct answer, D. On the outside of the drawer. A file drawer is labeled on the outside so it is easy to locate the correct file. If the drawer is labeled inside the drawer, A, it would be difficult to locate the correct drawer. The side of the drawer, B, would be difficult to see. A tickler file, C, is a reminder file for active documents. Keeping the drawers listed in the office database would not be helpful. The drawer itself needs to be labeled so files can be located quickly. E. 46. The ICD-10 PCS procedure codes are to be used only in what setting? A. The emergency room. B. Inpatient hospitals. C. Provider offices. D. Pharmacies. E. Psychiatric long-term care homes. Correct answer, B. Inpatient hospitals. Only inpatient hospitals use ICD-10 PCS codes. The emergency room, A, uses ICD-10 CPT codes. Physicians' offices, C, continue to use CPT and HCPCS codes for their services. ICD-10 PCS codes are not used in pharmacies, D, or psychiatric long-term care homes, E. 47. Which of the following documents is the record of a professional meeting? A. Minutes. B. Agenda. C. Bylaws. D. Itinerary. E. Resolution. Correct answer, A. Minutes. Minutes are the official record of a professional meeting. They include the date, time, location, and topic of the meeting, as well as those attending, those absent, topics discussed, and time of adjournment. The agenda, B, lists the order in which business is to be conducted during a meeting. Bylaws, C, are the rules established to provide guidance as to the structure and business practices of a company. An itinerary, D, is a list of travel information. A resolution, E, is an order of business or action taken by the governing body of an organization. 48. Which of the following should not be included in a job description? A. Supervisor's title. B. Job duties. C. Job specifications. D. Job summary. E. Address of office. Correct answer, E. Address of office. The address of the office should not be included in a job description. All other items should be part of a job description. 49. A physical inventory of office equipment should be taken. A. Every year. B. Every 2 years. C. Every 3 years. D. Every 5 years. E. Every 10 years. Correct answer, A. Every year. An inventory of equipment should be taken at least once a year. 50. Examining a document for damage before filing it is an example of which of the following filing steps? A. Conditioning. B. Storing. C. Releasing. D. Sorting. E. Indexing. Correct answer, conditioning. Conditioning is the first step in the filing process. It is followed by releasing, indexing, sorting, and storing. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.